Hello and welcome to this demonstration video of the Limbs and Things Cardiovascular and Respiratory Examination Trainer, CaRE. This realistic and comprehensive trainer enables healthcare professionals of all levels to train confidently in the identification and diagnosis of a range of respiratory and cardiovascular conditions from normal to various disease states. CaRE allows for the training in the key areas of inspection, palpation and auscultation. CaRE is an anatomically correct middle-aged torso which is representative of a typical patient. It contains all the relevant bony landmarks including clavicles, ribs and sternum. It's available in both light and dark skin tones, with both models having differing facial features for better representation. The included add-on breasts are easy to transform CaRE from a male to female patient and to help teach the key skills of communication and tissue management around the movement of breast tissue to access auscultation sites. The key palpable features are bilateral pulses in the carotid, radial and femoral sites, thrills over the aortic, pulmonary, tricuspid and mitral valves, a heave, chest rise and fall, along with a movable trachea to demonstrate tracheal deviation, along with 23 heart sound profiles and 10 lung sound profiles that can be listened to via the limb pad on a stethoscope or speaker. Setting up the model is really straightforward. The model comes with a battery which will need to be installed before first use. This simply slides into the slot on the bottom. Once fully charged, the battery will last for 8 hours. Also included is a removable base which allows CaRE to be either used in the supine or upright position and can be removed completely to allow CaRE to be placed in a hospital bed. To connect the base, simply push on like so. You'll also notice on the base is the serial number which will be needed to connect the model to the device you're going to use later. When you're ready, you can lift CaRE into the upright position. Once in the upright position, also included are 2 straps which can be connected to the anchor points on the side of the base to securely connect the model to a table. To use CaRE, you'll need to attach the model to a Wi-Fi enabled device. Here I'm using a tablet, but a phone or laptop can also be used. Turn the model on by pressing the power button on the side. Then on your Wi-Fi enabled device, open up the Wi-Fi settings and select the serial number of the CaRE unit you're attaching to. When prompted, enter the password CaRE1234. Once connected to the model, open up any web browser of your choice and type care.local into the URL. This will bring up the user interface that is used to control CaRE. The user interface is split into 3 main sections: individual skills, clinical cases and assessment mode. These can be navigated via the menu on the left-hand side of the screen. The individual skills section of the user interface allows learners to feel skills in isolation. For example, a normal or a weak pulse. Being able to feel all the individual skills can act as a building block for learners to give them a solid understanding of the skills before moving on to more advanced scenarios. In the clinical cases, users can take the next step in the learning journey and select and play any of the 31 clinical cases, from a range of common to more infrequent conditions. The cases showcase our patent pending technology with the pulses, lung and heart sounds, mouth sounds, chest movement, all synchronizing together. These skills synchronizing together allows the model to realistically represent the clinical presentation. The final mode is the assessment mode. In the assessment mode, this allows students to practice the key skills needed for clinical examination and diagnostics. Comparing their results to the creators allows for instant feedback. To play an individual skill, simply select that skill from the menu. Here we've selected pulses. On the right hand side of the screen gives you the various parameters that can be altered for that skill. For pulses, we have character, rate, rhythm and symmetry. Click on each variable and when ready, press the play button. The model will now start playing the selected skill, in this instance a normal pulse. To change to an abnormal pulse, simply press the pause button, change the desired variables and press play again. The model will now play the new pulse, allowing students to easily switch between normal and abnormal pathologies. In order to auscultate the model, a limb pad needs to be connected. To connect the limb pad, turn the limb pad on via the power button, then go to the settings menu in the user interface, select Connect Limb Pad, ensure you're connecting the correct limb pad using the identification number on the bottom. Once connected, the LED will turn solid and the limb pad will appear at the top of the user interface. The limb pad can be either attached to a standard stethoscope, like so, or connected via an auxiliary cable to an external speaker to enable group learning. To play a clinical case, navigate to the clinical case section on the user interface. Here you will be able to select any of the 31 clinical cases. In this instance, we've selected sepsis. Once on a clinical case, on the left-hand side of the screen are the patient notes, including patient history, investigation results, including ECG and X-ray. On the right-hand side shows what parameters the model is playing. Here we have a weak pulse at 170 beats per minute with a respiratory rate of 30 and normal heart and lung sounds. To listen to the heart and lung sounds, we need to place the limb pad onto the chest. We can auscultate both the front and back of the trainer. The final mode is the assessment mode. To make an assessment mode, click on the left-hand side of the menu. Select Assessment Mode, select New, enter the admin password when prompted. Once in the assessment mode, choose a clinical case to base the assessment off. Once you have selected which clinical case to base the assessment off, you are able to edit all of the patient notes to make the assessment completely bespoke. Once you have finished, hit Save in the top right-hand corner. To start an assessment, select the relevant assessment. It's now up to the student to fill out the observations and diagnosis based off their examination findings. Once finished, select End Test. This will pull up the student's answers against the assessor's answers. To save these results, click Export. The final section is lesson plans, where you are able to curate custom playlists of various skills and clinical cases, giving flexibility in both classroom and self-directed learning scenarios. To summarise, CaRE is a cardiovascular and respiratory examination trainer that teaches the key skills needed to successfully carry out an examination, focusing on palpation and auscultation, as well as the ability to practice the more advanced diagnostic skills. We have a user guide alongside our quick start guide for the user interface, which are available by scanning the QR code on the base. Thank you very much for watching. If you have any further questions, please visit our website or speak to your local account manager.